Thank you, Dr. Nehaji. Now we are moving to English session. Thank you, Hindi team. Now today is our 1526th day of continuous webinar. Let's start our webinar with a silent prayer. Good evening and warm welcome to everyone for today's webinar. Today is our 1526th day of continuous webinar. Today's our guest is Professor BAINU Sharma, MD. She's working in the Department of Materia Medica in Hello. Professor BAINU Sharma, MD, Department of Materia Medica, GIMS Homeopathic Medical College and Hospital, Hyderabad. More than 22 years of clinical experience. Today's our subject is art and skill of observation in homeopathic practice. So I am welcoming Dr. BAINU Sharma. You're welcome, please.
Namaskar, ma'am.
Now my screen is showing. Yeah. Now
visible.
Yeah. This is your slide, right?
Perfect. Nice.
Yeah. Okay.
So, namaskar. Very good evening to all the listeners. And welcome to yet another second session of the topic which we started the previous Monday. Thank you, ma'am, for your warm welcome. And let us continue for the session for tonight. And most probably we'll be able to conclude the session today. I'll try to make it fast and conclude the session. So,
no problem, madam. You can take. Anyway, our webinar is a continuous webinar, so
that is very true.
No
because
problem.
the topic on which we are I am talking is to be explained with the help of cases.
Yeah.
And along with that, I am emphasizing on the little theoretical part also. So that is why this is a little time-consuming topic.
No problem. This is a continuous webinar. You take your time. So if it is not finishing today, we will continue with the other session. That will be happy for everyone. Anyway, we are sitting here to learn. So
that is perfectly okay with me, ma'am. Thank you. Thank you so much for your support. Let us start with the session. This was the last slide I remember. Now let us come to the other slide and let us start learning. So in the previous session, we discussed about the importance of observation. We discussed what observation is. Then I shared with you 4 acute cases, which were acute emergency cases, which we managed in our casualty, which we monitored in the hospital. So what was the basic learning from these cases? One, the accuracy of observation, how observation, and that too acute observation, is very, very important in homeopathic case taking. How, like, finding characteristics in a case with only the signs available and with only the examination findings, we were able to intervene in these acute cases. How the conversion of the signs into the repertorial language, into the repertory, helped us to prescribe medicine to these 4 cases. How we selected the potency depending on the pace of the disease, depending on the susceptibility of the patients. Finally, how we monitored these cases to assess the selection of the remedy and to assess the response of the remedy. Those who were not, those who didn't log in the previous part 1, I think it is available on the YouTube. You can go through the previous YouTube lecture on the previous section. And today, let us learn about yet another very, very important factor under observation. That is the importance of non-verbal communication in observation. In this phenomenon of case taking, in this setup of a case taking, when we are listening to the patients, we are not only listening to his verbal communication, we are also listening to what is not said by words. So anything that communicates a message to us, but which is not in words, which is not verbal, that is a non-verbal communication. So there are many emotions, many features which you can actually observe non-verbally also. Like you can observe when a patient feels he is in danger. You can observe the emotions of the patient. By merely looking at a person, you can find out the person is happy or the person is sad, whether the person feels depressed. You can find out his desires by showing him things which he like. His mood will be elated. He will be having a continuous smile on his face. You can observe the mannerism of people coming to your clinics, their skills, their competencies, their status, their trusts. There are various factors which not only verbally, but you can observe non-verbally when a patient enters into your clinic. And decoding this non-verbal communication is very, very complicated as compared to a verbal communication, which is a direct version of patient story. So we need to pay attention to various factors when we are observing the patient, keeping aside the verbal part of the patient. So in that, we have to keep in mind the body language of the patient. We have to keep in mind the facial expressions. So we should constantly make a communication with our patient directly without even missing for a second. We might miss an important important tip from a patient. Everybody has grown up listening to this saying that action speaks louder than words. Every movement a person is making, every movement has a meaning, every movement has a message. And then this non-verbal behavior, this is totally in a non-verbal section of your brain. And that is reflected even before a person talks to you. Those signals are given to you even before he starts thinking what he is about to speak. So it is very important to catch hold and to click that at that particular time when you're listening. That keen, that sharp observer, a homeopathic physician should be. And this skill comes over a period of time. This skill is not a one day's skill. This has to be practiced again and again and again. A very famous professor who is a visiting professor now of psychology at the University of California, Albert Mehrabia. He has given this communication model, which is called as 7%, 38%, 55% communication model. In this model, he says that in all the communication factors, only 7% of the communication is via the spoken words. 38% is via the tone and voice of a person. And the rest 55% holds the non-verbal, that is the body language of the patient. So now we understand how important is the observation of all the body language, all the expressions the patient is given. Not only Albert Mehrabian, the importance of observation has also been mentioned in our organon of medicine. If we go through aphorisms 245 to 263, where Dr. Hahnemann has mentioned about the management of the cases, especially in the aphorism 253, he has mentioned that after giving a medicine for a short time span, we will see the aggravation or amelioration phase of that patient. And we will tend to miss that phase of aggravation or amelioration if we don't have a keen or close observation. This is the aphorism 23rd, where I've highlighted the observation importance mentioned by the master, where he says that the whole demeanor of the patient are the most certain and most instructive. Of the whole demeanor and of all the gestures, postures, and action, which may be easily perceived on close observation, but cannot be described in words. So not only do we hold this, but it is yet again mentioned in the organon how important observation is and how we have to be free of our preconceived notion and how we should practice to be unprejudiced observer. Let us understand this keenness of observation. Let us understand this sharpness of non-verbal observation through these cases, which I'll be discussing today. I have prepared 2 cases to be discussed today. In the previous session, I discussed 4 cases which were acute and emergency cases. Today, I'll be discussing the chronic cases which came to the hospital and which we took over a time span of almost 1.5 hours we took to take these cases. So let us start with the first case. This is a case of a female coming to our clinic in April 23, 29 years old female who was BTech by qualification. She was working as a software employee when she came to us. And when she came to us last year, she was married for 4 years. She was a resident of Hyderabad. She came with the chief complaint of primary infertility, came to the hospital after seeking various helps from all the fraternities of medicine, including modern medicine. She underwent necessary investigations like hormonal assays, ultrasonography, then hysteroscopy. She underwent IUI, she underwent hormonal replacement therapy, IVF, and this whole process took at least 16 to 17 months before she came to our hospital, where she started with hormonal replacement therapy, and then all the IUI and hysteroscopy followed upon. And when she came to the hospital to ROPD, she was completely hopeless. So she was literally dragged by her father to our hospital, and her father was a regular patient in ROPDs. So he got her when she came to her father's place, which was very close to our hospital. Then, on asking about her chief complaints, the father started narrating the complaints. He said that, doctor, my daughter has tried fertility treatment from everywhere. She has left no stone unturned, but in vain, this failed all the time. And I was looking at the patient. The patient was just sitting very quietly besides her father. Then we thought that it is best to send the father out and let us have an interaction with the patient, because I could sense her uneasiness narrating her case of infertility with her father sitting by her side. So we sent the father outside. This is I think the screen has. And to her surprise, as soon as the father left the room, the patient grasped some air, and on further probing into her case, she started narrating her whole life space story to us. So this was her life space investigation. She told us that she was born and brought up in Hyderabad. She completed her undergraduate BTech, and then she was currently at that time an IT employee in Hyderabad itself. Then she started telling us that she had a very dominating father who, since her childhood, controlled her literally. She felt being dominated against her will, as if her father, literally suppressed her individuality. She told that she's constantly living in self-denial. These are the patient's word, mind you, which I'm telling you. She told us that she's, constantly living in a self-denial state, a feeling of an emotional drain. And while narrating this particular phase of her life, she started weeping in a very composed way, but she started weeping. She was married in 2019. She came to us in April 2023. She told us that she feels irritable at times. She told us that she gets angry when she's contradicted, but then she tries to control her anger, especially towards her in-laws. Even though she said that she can't take that for a long run, she has outbursts. She takes out that frustration on them, but she first tries to hold herself. She tries to control that. But when she came to us the day, she said that she's very sad and she was totally hopeless about conceiving, because everything failed. All the procedures failed, all the treatments failed. But whichever doctor, whichever treatment was told by her peers, She followed that very religiously. Still, there was no positive results, so she was totally hopeless. But this constant peer pressure that she is not conceiving, that made her feel more and more criticized. So after listening to this, I felt that the patient is gaining confidence in me. I felt that she is narrating her life story to me. So maybe she'll open up a little and she'll gain faith, because I just wanted to keep aside her hopelessness and show her a little light and show her a little hope that homeopathy can help her in her state. So, in her past medical history, she suffered from chickenpox when she was 13 years of age. She had a history of hemorrhoids 4 to 5 years back. She also suffered by COVID-19 in 2020, where she told us majorly she had minor respiratory complaints. In the family history, his father was taking medicine from us for hypertension. Mother was a hypothyroid patient, even hypertension. In physical generals, appetite was satisfactory, thirst 2 to 3 liters per day, desire for salt, aversion curd, desire spicy food, causes sour eructations and bloating, perspiration mainly on the scalp and the forehead. Urine was clear, odorless. Stools habitually constipated. She used to strain while passing stools, hard stools. She also had hemorrhoids earlier. Sleep was refreshed. Dreams she didn't remember. Thermals, we could make out that she was towards chilly, but nothing very, very specific came out. In the general physical examination, she was a moderately built female, moderately nourished. BP, pulse, weight, everything was checked. There was nothing very, very significant about that. Everything was very much within the normal limits. In the systemic examination also, everything was perfectly okay. Then we took her menstrual history. Then we came to know that she also is a patient of, or a known case of premenstrual syndrome. Menarche started at 13 years of age, and LMP was 8th of April. Cycles were regular, 4 to 5 days of duration. Flow was moderate. Occasionally clots, dark red color, slightly offensive. Then we asked her what were the complaints which she used to feel at her premenstrual phase. She told pain in the abdomen 2 to 3 days before. Then she used to develop acne before menses, then diarrhea, then tenderness in the breasts, and hunger. She said, I usually feel more hungry 2 to 3 days before, and then suddenly I used to realize that my periods are about to come. So this hunger and acne was the indicator for her to remind her that she is going to get her cycle soon. Leukorrhea before menses. And she said that all her situation, all her PMS was always better in open air. So she used to seek for open air. This was her menstrual history, which was strikingly very, very important for us. This was a totality we formed. Ailments from domination, ailments from suppressed anger, delusion, imagination, influence is under a powerful, confusion of mind, identity as to his, pressure, constant feeling, anger on contradiction, irritability, feeling of helplessness, sadness, feels overstrained or drained, amelioration, fresh, cool air, acne, menses before, hungry, menses before, stool, habitual, constipation, straining while passing stools hard, and history of allopathic medication and hormonal pills. These were the symptoms we considered. And then we repertorized, and on 22nd of April, we gave her folliculinum 30, 3 powder doses OD for 3 consecutive nights at bedtime to be taken on a clean tongue, rinsed mouth, followed by placebo TDS 30 number globules for a month. We gave her a few instructions like if any acute ailment, she should contact us, and regular exercises, avoidance of any junk food, and to follow regular meal. 6 to 8 hours of sleep, and avoidance of any self-medication. With these instructions, we asked her to follow us after a month. She came on 20th of May. Sleep was fine, appetite was good, stools were regular, everything was usual with family and work. She got her periods on 5th of May. Then we prescribed her folliculinum 1M, 3 powder doses, OD the same way. Again, we sent her for a month. Then she comes to us on 17th of June with a dragging pain in the lateral side of the abdomen on the right side. Low backache since one day, which was radiating to the hip. Weakness, tiredness, easy fatigue. Appetite increased since 3 days, which was more in the morning. Sleep disturbed 2 to 3 days. Then she said I had a missed period in the June, which was due somewhere near first week. So she took a pregnancy test, which turned out to be UPT positive. Then she got that UPT pregnancy kit, and we gave her placebo, and we asked her to visit some nearby GYOBN for her antenatal checkups. And we also asked her to confirm her pregnancy within ultrasonography after 2 more weeks. Keeping in mind her convenience, because she came to us for the first time because she was visiting her father, who was staying near our hospital. She was staying a little far away from our hospital. So keeping in mind her convenience and her comfort, we asked her to keep a regular antenatal checkup and keep her follow-ups with a good GYOBN, which was known to her or which was her family physician. She religiously followed whatever we told her. Immediately the same day, she visited the gynae obstetrician. Before going further to the case follow-up, let us learn about the rubrics which are there in folliculinum. Folliculinum is a very, very interesting remedy. Folliculinum is a deep-acting polycrest remedy, which usually is a very underrated drug. But I am using folliculinum in my OPD, especially for menstrual irregularities, for ovarian cysts, for infertilities on a regular basis. So these are the rubrics from synthetic repertory about folliculinum. Mind raped being aggravation ailments from. Mind domination by others, aggravation. Mind delusion, imagination, influence is under a powerful. Mind, confusion of mind, identity as to his. Sensitive, oversensitive, sensual impressions too. Oversensitive reprimands, criticism, reproaches too. Sadness, anger, vexation, aggravation. Excitement, emotional aggravation. Excitable, alternating with sadness. I'm just telling you the literature of folliculinum doesn't mean all these symptoms were being covered in my patient. So it's just for your information, especially for those people who are students and who are still learning materia medica, or for those who've not yet used folliculinum in their clinics. It's just for their information I'm sharing these rubrics. Generals, food and drinks, food in general, desires, menses before. So these are the rubrics which I compiled from the synthetic repertory, which were very specific for folliculinum. So, and the result is in front of you. This was her sonography report, which she underwent on 28th, where it was seen primary with 6 weeks. I think she might have conceived somewhere in 2nd or 3rd week of May. After taking treatment, she started on 22nd of April. So this is what she got in the next follow-up. Not only this, on I think 17th of February, next year, 24th, the patient came with the whole family carrying a 10 days old healthy baby boy. This is the image my PGs took in the OPD when the whole family visited us with a just 10 days old boy. She came for her backache, but she got the baby just as a thank you gesture maybe for the team. And now you all can imagine the joy homeopathy got to this family. the positivity, the hope we got to this family, that they were so overwhelmed, they were so thankful to homeopathy that they made a video and they sent it to us. This is the video. I don't know whether it is audible.
To places since 3 years we have planned for a child, and so many hospitals we visited regularly. So most of the preliminary checks were done, and like follicular study and tubes blockage, etc. Everything was ruled out, everything was fine, and we didn't have an answer. And later, after wasting much of our time, we were sent to fertility treatment, like we were routed there. So I have been through 2 IUI cycles, and also undergone hysteroscopy later, as they do. As the I was in a position that I will not go further for any of the treatments, because lots of scans and lots of stuff has happened in between. So this all happened in the phase of November to March, and by March I lost all the hope. And then one day, my father, who stays at Muchintal nearby, went to my maternal home just as we had few holidays. So then they came up with a plan to go to take me to the Jim's hospital and have the homeopathy treatment taken. Frankly speaking, I did not have any hope on any of the treatments, and same for the homeopathy. Same was the case with my husband. We just went as they had some hope on it. So we gave a shot, and then we met Dr. BAINU Sharma, who was very calm, patient, and listened to everything what we were saying. And she got all the answers what she wanted, and we were not forced to go there like every alternative day, which usually happens like for the follicular scans, that scan, this scan, nothing. And the only thing she asked was our history, and then she gave a normal medication, which was not like plenty of tablets and stuff, which I earlier used to take, only small pills that took for just a bottle of pills. And same for my husband. Then in 1.5 months or so, I was conceived, and that was my third visit with the doctor. So you can blindly trust the doctor.
So this was the gesture of thanks given to us by this beautiful couple who became proud and happy parents of a very healthy baby boy. I just wanted to show this video to you to tell you that how affected the patient becomes in treatments like infertility. Mentally, how hopeless they become over a period of time. We, being homeopathic practitioners, we can just lessen or shorter this time span. We can make our patients more comfortable. We can give them a comfortable treatment. We can help them escape from this torturous treatment. Every pathy has its scopes and limitations. It's not about degrading something or saying good about something. It's all about, within your own limits, treating your patients. So yes, this was one infertility patient which was successfully homeopathically only by that keen observation. Let us again discuss one more very interesting case which came to our OPD. Again, a very chronic case and a very interesting case. So this female, 42 years old female, she was advised to visit our hospital by one of our PG scholars who was regularly consulting this patient for the past, I think, who consulted this patient for 3 months in the camp. Let me tell you a little background story about this patient.
Doctor,
who prescribed her in the camps. And my observation started from there itself. The time, the moment he started narrating the case to me, I started, observing the patient's attitude, the patient's behavior, the patient's pattern. My mind started clicking from there itself. He told me that, ma'am, this lady was visiting me for recurrent headaches, and I was giving her medicine and she was better. So, because she felt better and she felt comfortable with this particular PG scholar, she got her daughter to the PG scholar for a counseling. So, he started counseling. Before the counseling, she told the PG scholar, before she got the daughter, that she got her daughter's marriage fixed. And the daughter is completely denying the proposal because the match fixed for her happens to be 11 years elder too. So the doctor also became very reluctant and he thought, yes, that is actually not a right decision. Why will a girl marry at 10 years old? He started thinking that. He told me that. So she said that I'll bring my daughter to you. Please convince her, please counsel her and, ask her to marry this man. Maybe she'll listen to you because you're very good at convincing people. So he asked, okay, you get your daughter. She got her daughter to that camp only. And then he, listening to the daughter's state of mind, her reactions towards that 11 years elder proposal to her, which was a very forceful situation to her by her mother. The doctor.
hello, doctor. Hello, Dr. BAINU.
Married to a man.
There is some disturbance in, I think there is an internet.
Is it so?
Yeah, now it's okay. In between, there's a glitches.
Ma'am, just remind me, because if it is like that, just remind me. I'll keep on talking and then the matter we might miss.
Yeah. Okay,
Thank
now
you.
we can continue. Now it's clear. In between, it was like that. Okay.
So what was the part I missed, if you can tell me?
No. Now it's not missed. Before, while beginning this case, the second case, it was like that. But we can read from the slide.
From the
So
TV.
no
Okay.
problem.
So then this patient's daughter came, the PG scholar talked her out of the marriage proposal. So when he was doing that, when this conversation was going on between the PG scholar and the patient's daughter, she overheard him talking like that to her, and she just grabbed her hand in the middle of the consultation and she took her away back to the house very abruptly. Even the PG scholar was taken aback by this attitude of this patient, that what happened to her simply abruptly. She just caught hold of the daughter and took her away. And maybe she was not liking, because she wanted him to counsel the other way around, to convince her to get married, and he was doing it just the opposite. So then the PG said that, ma'am, she was not seen for quite some time. And then one fine day, the daughter turns up after a few months. She was all married, all depressed, very sad, and she was weeping. So she came to the same PG scholar, telling him how she was forced by her mother to marry this man who was not at all taking care of her, who was totally ignorant about her, who was not at all a good match to her, who was not at all a good husband at all. So again, he said, ma'am, not only this daughter was sitting with me, I saw the mother also was accompanying the daughter, but she never dared to come to my table. A person who was taking medicine from me, was even feeling better, didn't approach the PG scholar, but she went to some other PG scholar on some other table in the camp, same camp. So he said, when I was looking at her, she was totally hiding from me. She was not even willing to look at me, as if she's just trying to hide from me. So I said, okay, I started keeping those things in my mind. But I really appreciate the keen observation of this particular PG scholar of mine. He said, while I was talking to the daughter, she was away. Earlier, she was very keen to listen to our conversation, but this time she was hardly bothered and she changed the doctor. Then he said that she again came to me. She said, I'm having not headaches. I don't have headaches anymore, but I'm having lots of pain in my knee and back. And I have also developed high blood pressure, for which I'm on allopathic medicine. In the meantime, that marriage happened, and then the daughter sad and depressed post-marriage. In this whole phase, she started having pain in the knee. She started having backache. She started having, disturbed sleep and developed hypertension. So the PG thought that then camp is no more the right place for us to treat her. He advised her to visit to our hospital. He advised her to come to our OPD so that we can take her whole life space investigation and treat her accordingly. She got convinced. And the day before she was coming, my PG scholar narrated all this background story to me. So she came and she came with a chief complaint of pain in the right knee joint over the last 7 to 8 months, which was gradually increasing with time. She had tingling in the feet as if asleep. She had dragging type of pain. Pain was aggravated by flexion of the knee, by physical exertion. The pain was better by rest. Pain in the lower back was aggravated by sitting, better by lying down. There was no history of injury, no specific time modalities. And another very important complaint which she came was complaints of disturbed sleep, unrefreshed sleep. She told us that is mainly because of this marital disharmony which was going on between her daughter and her son-in-law. On asking the past medical history, she told us that since last 4 months, she's also on antihypertensive pills. Then again, recurrent headaches on which she was on homeopathic medicines only from the camp. X-ray, she got an X-ray on which we saw very early degenerative joint disease of the knee. Physical generals, there was nothing very specific except the disturbed and unrefreshed sleep due to persistent thoughts about her daughter's married life. Father was healthy. Mother had type 2 diabetes since last 1 year. Brother had type 2 diabetes. Sister also had type 2 diabetes, hypothyroidism, RA, and uterine fibroid. This is the family history of the patient. Menstrual history was perfectly okay. Everything was regular, fine. Nothing very, very specific in the menstrual history of the patient. On examination finding also, everything was okay. BP was also 140/80. So then in the life space investigation, on asking, the patient opened up because she was familiar with the face of her PG. So she told us she got married when she was 15 years of age. She told us that she had a very good relation with her husband and that she shares everything with him. She said that she likes honesty. She likes people who are very, very straightforward. She does not like to be lied at all. She does not like that behavior. She was very, very fastidious since her childhood. She likes everything neat and clean. Even if she is going to her relative's house, she'll clean the house. Because if they are not clean, she cannot eat at their place. Even if she is sick, she keeps everything clean and tidy. She'll not be lazy that way. She says that if people are nice to me, then she tends to believe them easily. And she tends to forget people if their behavior towards her is very, very nice and warm. Very aggressive, very expressive female. She said she shouts when she's angry. But at that time when she was sitting with us on that day, she said, presently, what is mentally disturbing me very much is my daughter's disturbed married life. I am very much disturbed that my daughter is suffering And more so, I'm disturbed that my daughter is suffering because of me. Then we asked her, why do you say so? Why will a daughter suffer because of the mother? She said that it was me who forced my daughter into that marriage. I forced her to marry a man who was 11 years elder to her. I proposed that rishta for my daughter, for which she was definitely not willing to marry. She was denying it from the day one. Then we asked her, why did you force your daughter into such kind of a relationship, which we could foresee from starting? So she said that I get influenced by people very fast. So I went for a function. In that function, people were saying that, your daughter is getting elderly now. You should find a good match and marry your daughter. So somebody told this particular match to her who was financially very, very sound and a good family. So she got impressed by this proposal and then she became very, very headstrong and adamant that no, you should marry this man. It is a perfect match for you. That time she didn't think about the other things or about that age gap or anything. So she even emotionally blackmailed her daughter with suicidal threats that if you'll not marry this man, I'll commit suicide. Thereby, in the end, she convinced the daughter, and the daughter had to marry this man. She was not happy after marriage. The husband's behavior was very cruel with the daughter. Considering this situation, after listening to this situation, the patient asked the daughter to come back to her, but the daughter denied. She said, no, now I'm not going to come. Initially, why have you not thought of it? The daughter is also a little bit like her mother. She said, when I was asking you to just cancel this rishta, why were you after my life to marry this man? Now I'm not going to come back. Maybe she also indirectly wanted to make her mother suffer. God knows. So the patient got very much worried and mentally disturbed about her daughter. One, she is very much unhappy in her married life. Two, that she's not listening to her and that she's not coming back. These thoughts were disturbing her. And how were they disturbing her? What were the physical ailments? She started having unrefreshed, disturbed sleep. She started pain in the joints. She started pain in the back. She even developed high blood pressure, which was definitely in the family. She held herself totally, wholly, and solely responsible for this miserable state of her daughter. She felt very, very guilty about the whole scenario. She could not dare to share about this issue with her relatives, thinking that, they might make fun of me or they might laugh at me. That what a mother. She said relatives will not, help you anyways. When she's not married, she said they were after my life. Now, when she's not happy, they will be after my life. So she was not in a very good mental state. Then she started questioning the Almighty that, why he has not given her enough wisdom to make a wiser decision. So she started holding God also responsible for this act of hers. She could not look into the PG's eyes directly, with whom she was earlier consulting, as I told you before, with whom she was consulting for the headache, because he also priorly alarmed her and told her to not to go ahead with this marriage proposal. So the PG that day when she was sitting in our OPD, in the hospital OPD, the PG was also sitting. So he asked her that why was it that day when your daughter came after marriage, you didn't come to me and you went to some other doctor and you were not even looking at me. So in asking about this behavior, what she said that day was, I spoiled my daughter's life. I don't think I'll ever look into any other people's eye, especially those who tried to stop me from committing this act. What will they think about me? I just can't look at them. I can't look into their eyes. This was so prominent. This came out to be so prominent in this case that, we were bound to take this into consideration. This guilt, this embarrassment of forcing a daughter into an unhappy wedlock. Then we repertorized the case. And then we looked for rubrics. In the chapter of mind, under the rubric of delusion, we found a sub-rubric, wrong. Then we found a further sub-rubric, done wrong he has. Looked anyone in the face, and others knew this and could not. I want you to process this rubric particularly. Extremities, pain, knees, back pain, aggravated sitting, sleep, unrefreshing. So when we looked into this specific rubric, which was explaining the whole behavior of that patient at that particular time, there was only one drug under this rubric. And the only drug which was under this rubric was cobaltum metallicum. So we gave cobaltum metallicum to this patient in 1 potency, 3 powder doses consecutively for 3 nights, followed by phytum for 21 days. We advised her a calcium-rich diet, and we advised a few calcium supplements also to the patient, considering her perimenopausal age. Most observable behavior of the patient by the PG scholar in the camp and during the case taking in the hospital. On the basis of that, we prescribed cobaltum metallicum to this 42 years old female. After that, we looked back into our abode, that is our materia medica. We cross-referred the symptoms of cobaltum metallicum, and there we came across in the mind, all the mental excitement increases the suffering. This is a screenshot of Herring's guiding symptom. So not only am I discussing the cases with you, I'm also telling you a few drugs which are not very commonly used, which are a little underrated, but which when prescribed, as I told you in the last lecture, what is to be cured and what is curable. If we fix these 2 blocks very nicely, we get a similimum. So this was almost a similimum in this case. And sitting, aching in back, aggravation. Then we also checked the sleep, where we saw disturbed, unrefreshing sleep. So the drug was very, very confirmed. We were very confident in our prescription, and we sent her home for 3 weeks. This is the follow-up summary of the patient. She came on 29th of June. Sleep was improved by 60%, which she was very much, diseased. Then mentally, she was stable 50%. She appeared more confident to us and told us she would ask her daughter to seek our medical help. That was one good thing for us. She said, no, I'll bring my daughter also because she is majorly into depression. I want you to take care of her. So we assumed that she's getting better. That's why she's gaining confidence in homeopathic treatment. The complaints were 20 to 30% better from the knee and the back. She said she was able to finish her domestic chores more comfortably, unlike the earlier times. So we prescribed phytum for yet 21 more days. Then she asked that because the hospital is little far from my house, camp is little closer to my house, can I go to the camp and meet the same PG scholar who was treating me for my headache? So we were very happy, thinking that now at least he can look into the people's eyes. Mentally, she's becoming more stable and she's controlling her own self now. So we said, yes, definitely. I told her she can give her follow-ups to the PG and he will get in touch with me and we can decide the remedy at that particular time. So then she was visited, I think twice she visited in the meantime till September, from June to September. And she was given phytum only because she was perfectly doing well. Then she came to us on 27th of September, where sleep was perfectly okay. She had a refreshed sleep. Mentally, she was 90% better. Not only this, she took an appointment for her daughter from us. The complaints in the knees and the back were 80% better. Again, we prescribed her phytum. So again, next follow-up was given in the camp. Then she last came to us on 19th of October. And what she said is that, ma'am, I wanted to discontinue my antihypertensive pills also, and I want to switch over to homeopathic treatment for my high blood pressure. All the complaints were better. That time BP was 140 by 86. So because everything was perfectly going on fine, there was a general sense of well-being. The generals were improving, the pain was improving, BP was under control. So we asked her to taper down her dose, to take it alternately. And alongside, we advised, again, gave her Phytam, and we also asked her to do a repeat X-ray, which we are awaiting because she came on 19th of October. So yet another rare remedy prescribed as a constitutional drug, which to our surprise also, after listening and after keen observation, on the basis of that one specific rubric we gave, and how we brought a change in this female's life. A person who was very, very guilty, miserable, turned out to be very, very positive, and her daughter's follow-up is due. She couldn't make it because of the festival time. So I think probably this Saturday she's going to come to our OPD. And maybe next time we'll discuss the daughter's case and her follow-up if given a chance on this platform. These were the two chronic cases which I actually prepared for today, where this keen observation in the case-taking phenomenon in the clinical setup, how we observed and how we prescribed and how we made a repertorial totality. So we are a team of me being the professor, and then I have PhD scholars with me from all the batches and two interns. So we sit, we listen to the whole case, and then we decide the rubrics, then we make a totality, and then we prescribe. This is how we are working on cases in the hospital OPDs daily. And no materia medica, no homeopathic prescription is complete without the trio, the popular trio of homeopathic materia medica, homeopathic repertory, and homeopathic organon of philosophy. So what is the learning from these case studies? Importance of keen observation and noting down the symptoms, which are applying the principles laid down in the organon of medicine by our master. Importance of applying the skill of observation into homeopathic repertorial language. Importance of keynote prescribing with the knowledge of homeopathic materia medica. Not only is observation important for we medical professional peoples, we homeopathic physicians, but observation changes lives. Observation has created history in the past. Everybody is very well aware of the theory of evolution by natural selection. It was the observation over a period of time. Then everybody is aware of the discovery of penicillin by the great Alexander Fleming. Again, observatory. Then the Archimedes principle. Again, a revolutionary step in the science. And a very popular apple falling in the linear, the Newton's laws. So these are also the results of observations which have created history, which have changed lives, which have brought revolution in the field of science. That is how observation is important in day-to-day life. But
Thank you so much, Doctor.
I still am having quite a few slides, but I think I should wind it off before I exceed the time.
Yeah,
I
now
finished
we have
73 slides, ma'am, today, but I have 98 slides. So, because this is a very vast
what
topic.
I'm telling, we have time, no? It is a continuous webinar. Even we are very happy to listen from you because actually we are traveling with you through your OPD with your PG students. Likewise,
Because, ma'am, case taking is a teamwork, I feel.
yeah.
Which people will observe. So
we are also joining with you through your OPD, like narrating a story. You are telling the cases, even it's entered in our mind. The case
that is the whole idea behind. So that cases should imprint in our minds. If
Yeah.
something like that we also come across in our OPD, so we'll not miss that.
Exactly.
Specifically these two cases, because the very important behavior of these two patients, we made a reportorial totality on their specific observatory behaviors. So I thought we'll keep these two cases in the learning.
Yeah, those who are telling, they must have some, they must study the case, or anything if you are narrating, you must have clarity about that. So while you are saying, it is crystal clear, because you are so clear about the medicine and the case, I mean the personality, your observation is very clear. So thank you so much, and we need your classes more. And now we are moving. Anyone have question, Dr. Danesh?
Yes, as the time is over,
Good evening, sir.
what I can suggest is that definitely we can have the third part of the same, as per your convenience later.
I suddenly am sounding very demanding to the
Not
IFPH.
really, we are also about to demand that the presentations were really excellent. So naturally, we need this kind of presentation to motivate others also to study about all these things that are very, very important. As we know, we all know that the observation is a keen observation is the need of the hour, and that will definitely bring the success of the case. And that speedy recovery of the patient is one of the things that we can do even from the very outlook of the patient. So yes, instead of concentrating on the particular disease, the person need to look into the person as a whole. That is
Medicine selection, doctor. Medicine also, it's rare, right? We are not.
That was the basic idea to present these cases.
Yes,
Yeah.
rare remedies comes accidentally. Nobody never thought that this. Always people will may think in otherwise. It may be the way we can go with the constitutional medicine like that. But when a rare remedy become a constitutional remedy, then naturally we will have to choose that. That is the answer to that. Am I right?
Kamalesh Sharma is your parents?
She's my mother.
I was listening her. She's a proud mother.
Definitely.
Yeah.
This is what we require, because not only a presenter is presenting in front of doctors, but also in their family members also. That's the beauty of our session also. That's why our forum is filled with
Thank you, Kamalesh ji, for joining with us. And thank you.
Her audio is muted, I guess.
Yeah, I'll.
No, unmute. Please unmute, madam.
You can unmute yourself, please.
If you, yes.
Okay.
Thank you so much.
Thank you, madam. You both of you are listening from the beginning. I was watching from the face itself. I find it out. The proud parents are listening, and
My
your
parents
daughter
have listened to both the sessions, I guess.
Thank you so much.
Thank you,
It's
ma'am. Thank
a
you.
pleasure for IFPH because IFPH is a family. So you are also in the part of the family. We are so happy. So now it is the time for the Malayalam session. So it is time to end the English session. Thank you so much and come again.
Thank you, ma'am. Thank you.
Now I'm
very much
inviting.
for giving me this.
See you everyone. Good night. We'll see you tomorrow at the same time. Thank you, Dr. BAINU Sharma.
Thank you. Good night, everyone.
And who is the moderator? Dr. Danesh?
Dr. Danish is
It's Mariama John, I think.
Okay. I'm welcoming Dr. Mariamma John to moderate this session.